Welcome to This Week in South Carolina. I'm Gavin Jackson. This week, we're talking about our state's healthcare needs and developments amid continued growth in our state. And we have two people who are at the forefront of that. Dr. Cawley, Dr. Patrick Cawley is the CEO of MUSC Health, and Dr. David Cole is the president of the Medical University of South Carolina. Welcome to you both. Welcome back.
Thank you. Glad to be here, yes.
I know, it's been 2 years, but we got you back here in studio. With that being said, we have some great news to talk about, Dr. Cawley, and that's this cancer center that's coming together, the Comprehensive Cancer Hospital that will advance MUSC toward Comprehensive Cancer Center designation. This is a huge development. A long time, much needed too. What would such a designation mean, and how does this build upon what you all already have with the Hollings Cancer Center down there in Charleston?
Well, maybe the best question to start with is really what's driving all this. And what's driving this is the amount of cancer that we're facing today and that we're seeing coming into the future. 20% increases in the amount of cancer cases diagnosed in South Carolina in the coming year. And the other thing is, we have found when we're out in communities, if you've watched the rise of MUSC and the growth of MUSC in the last 7 to 8 years, as we're out in communities, the number one thing that every single community wants help on is cancer. Sometimes it's surgery, sometimes it's medicine, sometimes it's research, but we took a step back and said, what can we do to really help the entire state all at once, rather than just one-off these things constantly. And so we took a step back and said, we need to develop a comprehensive cancer network anchored by two things in Charleston: a comprehensive cancer center that is NCI, National Cancer Center designated. We are NCI designated today. This was a designation above that, so called comprehensive. And then the other thing would be to have a hospital, a dedicated cancer hospital in Charleston, not to treat everybody in South Carolina, but if you have a cancer that does need to be treated, that you don't need to leave South Carolina in order to get that taken care of. And then that would be part of a network. That'd be the hub of a network across the state. That network, some of that would be directly MUSC ourselves, some of it would be partners. We'd work with any health system across the state to help deliver that cutting-edge cancer care.
Just to add another view to what Dr. Cawley was saying, the Hollings Cancer Center has had NCI designation for 15 years. That means we provide excellent, best-in-class quality care, largely within the Charleston area. For us to get NCI Comprehensive Cancer Center designation, we, MUSC, actually have to prove that we're delivering for the citizens of the state of South Carolina highest quality access to the state-of-the-art care across the state. That's a high hurdle, but it's what our mission and purpose is. And this isn't about MUSC only, it's about with partners, with providers across the state. How do we build that network and capability? So the Cancer Center Hospital in Charleston is the epicenter of that, but we're building an ecosystem. We're building an ecosystem that will provide best in class for South Carolina.
Especially since there's been so much expansion that we'll talk about as well. But when we talk about this designation, does that make us something like an MD Anderson when people think of these cancer centers across the country?
Yes. These are the places that can treat all kinds of cancer comprehensively, right? So these would be rare cancers. These would be cancers that maybe not rare, but maybe have special issues that need to be treated in a place like MUSC. But then the other thing, as Dr. Cole pointed out, this will be a place to facilitate cancer care close to home, because all of us have had family members who have had cancer and who have been going through treatment. It's rough, right? And you don't want to be traveling, when you're going through chemo and radiation. You want to be close to home, right? So increasingly, we feel that the technology is here, the technology is getting much closer to be able to deliver this cutting edge care at home, facilitate it by the epicenter in Charleston.
And Dr. Cole.
Sorry, just if you look at it, I'll speak as a surgical oncologist, taking care of 30 years of cancer patients. When you say, we always talk about best care is local, and we actually want, if you have cancer and you live in Columbia, your local oncologist should be able to take care of and be able to provide best local care. But sometimes you fail treatment, you're looking for what's next, you want what would be clinical trials in terms of delivering the next capability. And with our presence in the ecosystem I mentioned earlier that we're building, that partnership and presence enables us to be in that community, partnering with those providers, saying, look, and here's a clinical trial that Ms. Smith can have as an option in Columbia. So that's how we start providing access and in partnership to do something that's meaningful for the citizens per se. And yes, there's things that can only be provided in Charleston, as the highest complexity care facility, essentially, that would be an equivalent of an MD Anderson and so forth.
And along those lines, too, when we're talking about wanting to keep people closer to home for that treatment, but even within the state, if you're traveling to Charleston for some of those more complex procedures, sometimes it's difficult to find lodging, or it's kind of an unaffordable area for a lot of people when they come to Charleston, whether that's for emergent care and there's the needs to stay long-term down there. Will there be any component to that for families that are maybe in need to be there longer but don't maybe have the means to stay?
Well, two things I would say to that. First of all, right across the street from where we're building this new hospital downtown is the Hope Lodge. The Hope Lodge, helps and does that exact thing that you're talking about. We are big advocates of the Hope Lodge. We help the Hope Lodge. They plan to expand. That's right across the street, particularly for those that can't afford it. But then right next to the cancer hospital is going to be a hotel or some kind of lodging, right? We're not exactly sure, but it's going to be lodging of some sort. There's a building there today called Rutledge Tower, which we use for predominantly ambulatory needs. We're going to decant that completely, and that'll be up for redevelopment. And then the best use we would see is exactly what you're talking about. Some kind of lodging, maybe hotel, maybe some short-term stay type place, and you're right next to the hospital. If you look across the United States, cancer centers that have that's a big plus for those patients in those places.
Because who would you be competing with in the region for that cancer center? Emory or where?
Well, we'd look to Emory, Duke, Mayo down in Florida would be the big ones that we're talking about.
Gotcha. And then along those lines, Dr. Cole, tell me how such a facility would fit into the academic aspect of this. You're going to have students rotating through, or is it going to be more residents and fellows coming through? How does that fit into what's going on right now at MUSC?
So I think we've had a lot of discussions through the years of the Innovation District.
Yes.
And what that innovation sort of corridor looks like. This, I keep referring to ecosystem. It's not merely a building, which will be state-of-the-art. It's the people that are part of that, the education that occurs there, the research that supports it to provide best standard of care, and the patient experience. We've been talking about and verbalizing that we're going to make 2 commitments to the citizens of South Carolina. We're committing to actually creating cures in cancer, and we're committing to best patient cancer experience for South Carolinians, period. And that doesn't happen with a building. It's having a facility. If you talk about the hotel right next door, where as a patient and family, once you're being discharged from the hospital earlier, you can stay in a location that's supported by the facility. Think Cleveland Clinic. Think MD Anderson. Those are the type of patient experiences that give you best in class. Going to your question, the academic side, we have outstanding research capability that we're just starting to apply as we speak. And some of that is actually redefining the standard of care in cancer in terms of cutting-edge clinical trials. We have clinical trials coming from CAR-T therapy that we have been developing that will likely enable that complex care that's starting to lead to cures to have a broader base of application, likely to be provided as an outpatient. So now maybe you can actually get it not in downtown Charleston. That's the things that we're excited about. So it's important to understand that this is a part of a whole. It's a critical part, the hospital, but it's also part of something that we envision to be transformative in terms of what South Carolina is going to have as a resource. And we feel very strongly that South Carolina should take care of South Carolinians, as much as humanly possible.
And to that end, we'll talk about this further, but the need for doctors and nurses and such. This could be a big recruitment tool, I'd assume, as well. To have such a hospital.
Yes, we're committed to expanding the number of physicians, the number of trainees for all different kinds of cancer residencies and fellowships, nurses, et cetera. So we see, we're going to expand because that's going to be part of what we need to do to build this ecosystem, as Dr. Cole's pointing out. And then at the same time, it will be a magnet for people wanting to come.
So, Dr. Cawley, to that end, we're talking about how much this is going to cost too. You're asking the General Assembly, I think, for $350 million in the funding. Big investment, but at the same time, we've seen years of big investment in academic and health research. I'm thinking about, I know this is different, but Clemson University's vet school obviously was a big one for Clemson. They wanted that $285 million vet school. That's huge. Then $175 million for the MUSC College of Medicine as well. And then we're also talking about what's going on here in Columbia at USC School of Medicine with their $300 million health sciences campus at Bull Street. And of course, we've also seen some partnerships with the Nursing College of USC and Lexington Medical. So now this is coming online. What do you see when you see all that investment and that need and this working together to kind of create and address these concerns about nursing shortages and doctor shortages and even tech shortages when we talk about our technical colleges?
Well, when I look at that, I see that's growth. That's South Carolina growing, and there's just a lot of needs and a lot of infrastructure to support the growth that is already here and is going to continue to come for the next 10 to 15 years, right? So, I think that investment has to occur. It's also incumbent upon us to make sure we're doing this together, and so we use those dollars together. So, we've said repeatedly, this is not just about MUSC. This is about an ecosystem for the state, and it's not just about MUSC health system providing care. We're going to link up with anyone who wants to be part of this. So, we're going to do that and work on that together. Healthcare manpower, that's a whole nother issue that we've been working on for a number of years. I was talking about this long before COVID. COVID came along, and all of a sudden everybody began to understand. It made the problem worse, and everybody began to really understand what the issues are. We've had great partnerships between particularly the hospitals in the state and the universities in the state and the elected officials and the legislature around all kinds of
because they see the vision and they see it coming to fruition.
Yes, and these are things we need to work with the technical schools, but you even need to work down at the middle school level to help students understand. People know about doctors, they know about nurses, but actually the biggest problem we have is what we call the tech level. These are pharmacy tech, radiology tech, surgery tech, anesthesia tech. This is a really good paying level of job that a lot of people just don't know much about. So we have to train, people at the middle school level to say these are options to think about. So if we really want to get our arms around the healthcare manpower problem, we really got to work on it together.
I would echo everything Dr. Cawley is saying. Through my eyes, workforce currently is in shortage and will be in crisis across the nation, and certainly in South Carolina. And we're working hard. Part of our responsibility, as a organization which is responsible for, as a state organization, is to help address. We educate. We have 6 colleges. We have educate every dimension of healthcare provider. We need to educate the heck out of everybody that is high quality and can deliver and be a part of this community in this state. We partner creatively, and I would say, in a future leaning sense, we need to redefine the model of care delivery, because as much as we work to create more training opportunities and pipelines and so forth, the need is going to outstrip anything that we can accomplish in the current way that we are delivering care. So we need to go to communities. We need to keep people out of hospitals. We need to keep them healthy within their communities, which is part of why our footprint across the state has been intentionally part of and in those communities that are rural and underserved, so we can start to affect what that looks like health-wise. You'd asked earlier about recruitment in the cancer hospital. Ray Du Bois, our head of our cancer center, has a whole strategic map, and as an example, and with support from the state, which we're very appreciative of over the last several years, that provide recurring dollars to help us to get to comprehensive. He's recruited and will recruit by next year 40 new PhD investigators. The number of physicians that are required in the cancer space alone has been a focus of attention. Gotcha. The great news is that again, we can train, we can retain, we can recruit, and we're doing that, I would say, with purpose.
Gotcha. Well, we're talking about the footprint here, and MUSC Health, under your purview, Dr. Cawley, has expanded, especially its investment in one hospital system. I want to talk about Tidelands Health and its 4-facility, eventually 5-facility system centered on the Grand Strand. MUSC Health has a 51% stake in Tidelands Health right now. You all got that approval last year by the JBRC. This system, like other systems you all have taken over, acquired, I should say, is facing some financial difficulties. So walk us through how that process works and the concerns some people have, but also the track record that MUSC Health has of taking over places like in Orangeburg and other locations across the state.
Well, consolidation is occurring in healthcare. And why is consolidation occurring? It's because the cost of healthcare. And there's just incredible pressure across the entire nation to, get the cost of healthcare down. One of the ways to try to get it down is to consolidate, is for small hospitals to join bigger systems in order to deliver care less expensively. So I don't think that is going to stop, right? I think that trend is going to continue because the cost pressures coming from healthcare remain extremely high and are going to remain very high for the next 10, 15 years, right? The number of people coming into healthcare, mainly driven by the baby boomers who are hitting an age, when they have the most need for healthcare, is going to drive healthcare costs, sky high. And so we're going to be really pressured as a nation. So that's what's driving it all. We started years ago working with communities, and over time, Tidelands is a good example. We started working with they were originally the Georgetown Health System. We started working with them in the mid-90s to help them with cardiology care in the Georgetown area. And that has morphed and changed over time until MUSC took a small minority stake in Tidelands back in 2020. We took a 30% minority stake at that time. We helped them develop different services. We helped them grow. We helped them do things a little differently. But even with us having a minority stake, it still wasn't enough. And so us taking a majority stake at this point in time, which really puts us on the responsibility to make sure that this goes well, right? And I got to give my team a lot of credit. I mean, we have really focused on doing things well from a financial perspective, turning around hospitals that are struggling, and I got a fantastic team that does this and really focus on it. We do have size, which does help us when it comes to scaling things, but we feel pretty good about Tidelands. Turning these hospitals around is often 2, sometimes 3 years. I don't think Tidelands will be more than 2 years, but we know them well, and we feel pretty good that we'll be able to provide more services in the area at the same time getting them in a better place financially.
Are you going to go to 100% stake at some point, or what's the progression there?
Well, we're at, when we went before JBRC, we talked about taking an initial going up to 51%, but there was a lot of assessment and fair market value being done. We technically have 85% today.
Okay.
So when the deal was finally actually closed on October 1st, it came to 85%. So that's what we have today.
And it's also in a very high growth area too. I mean, we're talking about the Low Country, but up in the Grand Strand, Horry County, Georgetown County, I mean, they're saying explosive growth as well. I mean, and that's what we're talking about. And even, McLeod Health has been expanding that area too. And when you see that expansion, both sides, both companies, both organizations, and we're talking about this coming wave, I mean, is that even enough still of what you've been talking about? I mean, it's kind of worrying.
I don't know. I mean, when you start to look at the numbers, when you start to look at exactly how many cancers we're talking about, how many heart attacks are we talking about, and then convert those into how many we would see in the hospital and in our ERs and things like that, it is mind-blowing. Sometimes I can hardly even believe it, but it's significant, right? We tend to not fully understand the
magnitude.
It's just the magnitude of this population surge that came after World War II. We kind of know it from the economics, but now healthcare is experiencing exactly what this means. So it's pretty big, and almost every health system in South Carolina is in full-on recruit mode, just to recruit more doctors, more nurses, more techs, more everything. Paradoxically, one thing that may help us is telehealth. So very early on, MUSC has been a big proponent of telehealth, aided heavily by dollars from the legislature, and that allows us to deliver care in more areas than probably if we didn't have telehealth we'd been able to do.
Yeah, and a lot of times it's for smaller things instead of having to go to a doc in the box or to the doctor yourself.
Correct.
You just pop on your phone and do that. But Dr. Cole, do you want to jump in here too?
So a lot of really important topics. I would say you'd asked earlier about our system. How's the system doing? And I'm going to ignore Tidelands for the moment. You know, the rural hospitals that we took control over. If you look on a national basis, the general paradigm is that they're going under. And
we hear a
why?
lot about, yeah.
Of course, because inability to recruit and retain providers, loss of confidence by the local community, outmigration is the term, increasing overhead, and you get into a spiral, right? You know, I think as an academic health system, we are uniquely positioned to weigh in a manner that's very positive with those hospitals to stop those dynamics. As I mentioned earlier, we can recruit and retain. I mean, every one of our hospitals, we have brought in significant number of new doctors, physicians, providers. You know, the confidence and quality within the community has been, I think, substantive. The impact we've been able to have locally is important. And as a specific example, Orangeburg, within 18 months, we brought them from years in the red to positive. In fact, every one of our divisions is in the positive. We don't want them to be anything more than high quality, highly trusted care facilities within those communities. And oh, by the way, going back to the discussion earlier about South Carolina should take care of South Carolinians, what do we want to say in downtown Charleston? We want to have the relationship and the trust with those communities so that the patient who needs a heart transplant actually has the ability to get to Charleston in a timely manner.
Sure.
You know, so it's a systemness, right? And we are succeeding. You know, we always hear about, oh, you know, they're underwater or this and that and so forth. You know, it's just not true. You know, and it's not that we know everything about the future, but I am very proud of the success that we've had on behalf of and with the communities in South Carolina.
And Dr. Cole, we've previously talked about your ways of retaining and keeping more folks in those communities too, including paying back medical school debt to keep those folks in those areas.
Yes.
I know that we talked last May about this. Have you seen, has that really been implemented yet? Are you still starting that program?
Yes. And again, so thank you to the state legislature and the leadership, you know, because we've been saying we need to be creative. How do we do things that can do specifically on this topic to, let me back up a step. I think my firm belief is that if you have a heart for health care in South Carolina, you want to help in your career take care of people in whatever form that might be, as a tech, a nurse, or whatever, you should have the ability to be raised, educated, and deliver for those you care in your communities. I mean, as a basic thought. You know, so it's another reason why we're excited to be a part of those communities, because we can help create residency programs in which physicians can go to highly underserved areas in which there's high needs for critical needs physicians, and we're setting up training programs in which once the medical student graduates, they have to match for further training to be able to practice. Those areas did not exist before. In Florence, in Catawba divisions, soon in Columbia, we're going to be 100, 150 new critical needs physician training programs in those communities. The statistic, which I believe is an AHIC statistic, is that the best predictor of a physician practicing in South Carolina, 50-50 if you go to medical school, greater than 75% if you go to medical school and finish your training in South Carolina. So the legislature has given us monies to basically say, if a medical student matches in a high needs rural residency in South Carolina, they'll get half their student debt paid off. And if they practice in that community for 4 years, the rest of their debt is paid off. I think in our medical school, I'm making up a little bit, I think we had probably 20% of our class was able to, by matching in that mechanism, to start into that pipeline. So stay tuned, because we're very excited. We're trying to have the levers to incentivize where the need is. And to have an impact that's long-standing in those communities.
We only have 2 minutes left, and I hate that because we have so much more to talk
Yeah,
about.
sorry.
But
Sorry,
no, that was great though, Dr. Cole. But you've also been expanding in your neck of the woods too, at the West Ashley Pavilion, and then also we're going to see some new hospitals coming online too. I think one in Nexton as well. So a lot of growth, not just acquiring but also growing. But to that end, I want to ask you a little bit about federal funding and any concerns you guys might have about Medicaid cuts through that one big beautiful bill that we saw, and how that might affect MUSC Health going forward.
Well, we're always worried about any time Medicaid is being affected, either at the state level or the federal level, because we're the biggest provider of Medicaid services in the state. So we always get worried. That being said, the One Big Beautiful Bill does have cuts in it. We do know what the impact is going to be, but the impact is over time. Those cuts are coming in over 10 to 12 years, right? And as long as we know, if those cuts were coming in next year, that's a whole different story, right? But we have time to react. So we've looked at it and said, let's all calm down, and let's just continue to march forward and do great things.
Dr. Cawley, really quick with a minute left. AI and its implementation. You all are looking at applications for AI. There's a fact that I saw that on a daily basis, 40 million people are asking ChatGPT healthcare questions. What does that say to you? And is that somewhat like WebMD on steroids? Is this a good thing? What are we getting out of this in about 30 seconds?
Well, brave new world. But I would say that I think most people consider the healthcare sector the most in need of and most likely to be transformed by AI. And so we're looking towards how do we actually enable that tool to provide more cost-effective care, better predictive care to prevent, and so forth. And right now, honestly, it's a little Wild West. But we're working hard as an enterprise to be coherent and to be leaders in that space as much as possible as it gets applied.
A lot of promise.
Yes.
All right, that's MUSC President Dr. David Cole and MUSC Health President Dr. Patrick Cawley. Thank you to you both, and thank you for tuning in for South Carolina TV. I'm Gavin Jackson. Be well, South Carolina.